Welcome to the Neuropathy Support Group and Podcast. I'm Chris, and I'm so glad you tuned in. It's my hope with this podcast to help all of us gather information that might help those that need support dealing with this debilitating issue. Before we get started, let's get the formalities out of the way with the medical and privacy disclaimer. I am not a doctor or medical professional. The information on this podcast is from personal experiences and is meant for group support. Additionally, the information discussed is not meant to diagnose, treat, or cure any underlying conditions associated with neuropathy. All names here within are private and will not be shared with any outside sources. Please consult your healthcare provider before making any health decisions. If you have medical concerns or an immediate emergency, please contact your doctor or dial 911.
Well, how's everyone doing on this Monday morning? I hope you all are having a great morning. You're able to get out of bed without having any pain. And those are my prayers for you right now. So, we are going to be talking about anxiety today. A lot of us go through that. I know I do. And, it's a mental issue. It could even happen when we're all feeling pain and we just want to stop it, and then that's when anxiety starts. But this episode is going to be 6 calming self-care activities for people with anxiety disorders. Alongside treatments like talk therapy and medication, lifestyle management strategies including self-care can help people with anxiety disorders feel better. Self-care is any activity that helps you keep up with your mental and physical well-being. In general, a solid self-care routine can help you curb stress, lower your risk of illness, and boost your energy. For anxiety disorders in particular, self-care can actually help make your treatment more effective. Self-care is crucial for individuals with anxiety disorders, as it serves as a fundamental tool to manage and alleviate symptoms. Here are 6 backed self-care activities that can help keep your anxiety symptoms at bay. Number 1, exercise regularly. It's well known that exercise can do a lot of good for both physical and mental, and anxiety is no exception. Exercise and physical activity can be powerful tools for treating anxiety. Research backs this up. One study showed that regular exercise may help improve symptoms among people with generalized anxiety disorder or panic disorder, with more intense exercise having the most benefits. As for which types of exercises are best for managing anxiety, it depends on what activities you enjoy most. If an individual enjoys yoga and running, then those activities would promote endorphin release to help regulate mood and can expel the physical energy associated with anxiety. Guidelines recommend U.S. adults get at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous aerobic exercise each week. If that sounds overwhelming, try starting smaller. Even small amounts of exercise, think 10 to 15 minute periods at a time, can help. Number 2, eat a nutritious diet. Eating a nutritious and balanced diet can have a profound effect on mental health. While diet can't cure anxiety, eating certain foods can help you feel better, while others can aggravate your symptoms. Prioritize whole foods like fruits, vegetables, lean protein, and whole grains, and limit your intake of processed, packaged, and fried foods. People with anxiety should also be mindful of their caffeine and refined sugar intake. It's important to avoid excessive caffeine and sugar, as they may exacerbate anxiety symptoms, which is making them worse. Next, number 3 is try meditation. Meditation, especially mindfulness meditation, is a tried and true relaxation strategy that can help you focus your mind and ground yourself in the present moment. With practice, it can gradually help reduce the tendency to worry excessively about the past or future. Here's some simple practices like guided meditation sessions or breathing exercises you can try, and they are incredibly effective. Find a quiet place to meditate. Sit or lie down in a comfortable position. Focus your attention on an object, an image, or your own breathing. When you get distracted, gently redirect your attention back to meditating. Take slow, deep, and evenly spaced breaths. Have an open attitude, following your thoughts to pass through your mind without judging them. Number 4, shore up your sleep routine. Sleep is important for everyone, but getting high-quality shut-eye can be challenging if you have an anxiety disorder. Nearly half of the people with anxiety have sleep problems, especially insomnia, or difficulty falling asleep and staying asleep. That's because those with anxiety disorders are more prone to sleep reactively. That means they're more likely to have sleep problems due to being in the constant state of stress and mental hyperarousal. This can become a persistent problem if not properly addressed. Anxiety can disrupt sleep, but lack of sleep can also worsen anxiety, creating a vicious circle and other things. A few ways to boost your odds of getting a good night's sleep every night are: set a sleep schedule and stick to it. Waking up and going to bed at the same time each day can help regulate your body's internal clock. Avoid caffeine and alcohol in the evening, as these substances can keep you wide awake at night. Make sure your sleep space is cool, dark, and quiet. Disruptions like light and noise can make it difficult to drift into dreamland. Try relaxation exercises like deep breathing or meditation to help calm your mind and body before bed. If these strategies don't help, tell your doctor about the symptoms you're experiencing. They can recommend professional treatments to help you sleep better. Number 5, spend time with others. Building and maintaining strong social connections is vital for mental health. Talking to friends, family, or therapists can provide support and reduce feelings of isolation. Engaging in social activities can also distract from anxious thoughts and foster a sense of belonging and purpose. Reach out to others regularly, either for support when you need it or simply to spend time with them. If you need help strengthening your support system, here's some tips that may help you. Look to develop friendships with multiple trustworthy people who can count on for different things. For instance, you might have one friend who you talk to about issues at work, or another who can listen when you're having challenges with your kids. Proactivity, reach out others rather than waiting for them to reach out to you, and offer support to them as well when they need it. If you're there for your loved ones, they're more likely to be there for you too when you need them. Make use of technology, which can allow you to connect to virtually anyone, anywhere. If you're not able to see a loved one face to face, send them a text or a schedule of time to video chat. Connect with people who have similar interests to yours. Do you love reading, hiking, or tennis, for instance? Consider joining a local club, meetup, or another organization to connect with others who are interested in the same things. Number 6, make time for your favorite hobbies. Engaging in your favorite pastimes can be very beneficial for managing anxiety. Participating in hobbies that bring satisfaction and joy can serve as a distraction from anxious thoughts. Whether it's painting or gardening, hobbies provide creative outlets and a sense of fulfillment. And that's the last one there. So here's your takeaway from the article I just read to you. Including self-care in your treatment plans can be very helpful for managing an anxiety disorder. When done alongside standard treatments like talk therapy or medication, strategies like regular exercise, a nutritious diet, meditation, prioritizing your sleep routine, and making time for hobbies can play a big role in easing symptoms. There you have it. Hopefully that'll help you out with your anxiety disorders. I pretty much take medication for mine, which helps me. I've never really tried any of these options that they're giving here at this time, but who knows? Maybe one of them will work eventually. But hey, I want to thank you all for being here and being part of this group. I really appreciate it. And I hope you all have a great week. Until I see you next week, I will talk to you later. Bye.
As we come to a close, it's my hope this podcast and other sources, such as product reviews that I have discussed today, can better our lives and give us some relief dealing with neuropathy. This episode plus others are posted every Monday on Facebook, Twitter, Instagram, iTunes, Spotify, and Stitcher. And finally, whatever life throws at you, even if it hurts you, just be strong and fight through it. Remember, strong walls shake, but never collapse. Talk to you next Monday.